These ones affects how we think, we feel, and act, because it's the center of our operation. How socially are we? How do we relate with the people? And with good understanding of mental health, it will help us determine how to handle things that affect our mental capabilities, such as stress, which and how we relate to others, and also be able to make healthy choices. You realize that for many years, there was a huge misunderstanding of mental health, and people dealt with mental health not in a more professional way, uh, because of the things that were surrounding mental health. If you remember back in the village, people were called madmen, mogoroki, mechizi, and all that. And until few years ago, when people realized that this is a condition like any other and need to be handled in the right way. So if you look at just a general picture of what is happening in the world, and we are saying the condition of mental health is more common than we think, because statistics are pointing out that 1 in 5 people, or 1 in 5 of us, will have a mental illness in our lifetime. And other statistics say that everyone, 1 in 4, will have some mental issues. And you see, most of the 1 in 4 will have a significant episode between the ages of 18 and 65, and majority of them may never seek they may never seek help or get help, because in most cases the mental illness, mental health, people don't see as if there is a problem. And but recovery of people who have some episodes of mental health is expected, and this is because when you avail adequate treatment. So the problem is there, and it's good to appreciate that when you're dealing with any 5 people, you realize that one of them at any given time in their lifetime, they can have an episode of mental illness. Why is mental health important to us? We are saying mental and physical health are equally important components of our health. And when one is not there, it affects the other one. And I'm going to give you example. If somebody is depressed, is having some episode of depression or strain or excessive stress, this increases the risk of many types of physical health problem. And you can see most of these conditions that come, the ones we find in the health sector as non-communicable diseases, they will have a long-lasting effect. And if somebody is diagnosed with diabetes, and this diabetes was triggered by maybe a mental condition that may be depressive, or that resulted from the work, or heart disease, or a stroke, it has a long-lasting effect on this person. Look at people who have had stroke because of what doing in the workplaces, people who are diabetic, people who have developed heart diseases. The treatment is long-term. And if you look at the statistics in the non-communicable disease department of our Ministry of Health, it's actually on an upward trajectory. And this other mental health can also be triggered by some chronic condition, like somebody who is having a terminally ill patient, or a terminally ill parent. Their mental condition will be affected, and so those conditions will increase the risk of mental illness. The same case in our workplaces. If there are conditions that are going to affect our mind, that are going to push us, or conditions that we cannot control, and we're feeling helpless, we will find that we might develop conditions that are not light, which can cause us to have poor mental health. So if you look at mental health, we have classified it into two. We have what we're calling good mental health, where somebody is stable, is well, and his mind is working well. And I've asked, what does it feel like when you have good mental health? The person feel energized, they are happy, they are socially okay, they feel confidence, and they are confident, they feel confidence about themselves, their performance, and all that. And you see these people, they are well smiling, their faces are radiating a reflection of what is inside them. They are well groomed, they are ready to engage, they will reason, they will listen to people and all that. But if somebody is having some problem or some poor mental health, they'll feel tired, they'll feel discouraged, they'll be unable to think or feel, they'll be unable to make decisions. They are always on a panicking mode. And these people look disheveled, uh, somebody who is not taking care of himself, or they are messy, they look ropey, sleepy, frowning, anger, they are agitated. And if they have the opposite of a happy face, or they are overly dressed, or unable to feel anything, and they want to do things that are going to portray a different picture. And you see somebody's, even if it's a makeup, they are over making themselves up, the way they are dressing, there's like, I want to be felt or to be seen, not because of anything else. They're feeling some inadequacy because their mental state is poor. Uh, if you look at the facts about mental health, they can take many forms. We have severe stress, we have depression, we have bipolar affective disorder, schizophrenia, others will have eating disorder, anxiety, post-traumatic stress disorder, complex bereavement and dementia. Some of them will get into drug and alcohol abuse. We have obsessive compulsive disorders. All these are some of the way the mental issue can manifest themselves. And these issues that you are seeing here can affect any one of us. None of us is immune to them. So it's not a disease of them, it's not a condition of them, and then we exclude ourselves. So we are all candidates of some mental problem. People who are suffering mental issues will feel very uncomfortable talking about mental health. Rarely we will see somebody admitting that they have mental problem. And the reason for this is the stigma that is carried with mental health. Every time you mention somebody has a mental condition, people think this person is mad. And the words at each and every community of us, they have those words that they refer to people with unstable mental issues. And that's why you realize those people with mental illness can, sometimes they are stereotyped and discriminated against. I'm reminded of years when we were young. Any person who expressed with mental condition, they talked of them being possessed by demons. And some of them would even be beaten thoroughly. They are abused because of the condition. Instead of people addressing the condition and all that, they'll be tied by ropes, dragged over, and people think they are pretending and all that. So with that kind of stereotyping and discrimination, most people will not come out openly and say, I'm suffering a condition. they will ridiculing someone who has a mental condition will create a barrier that make us think we aren't like that person. And so help is not a possibility. And The other aspect is that most of us think that it will never be myself. None of us ever imagine that I can develop a mental condition. So we always think it is them and not us. So even when there are symptoms and signs that are suggesting differently, you'll find that that person will not admit it. So the impact of stigma is worse than the symptom of the illness to some people. And we are frightened of mental illness in a way that we are not about with the physical diseases. It's easier for somebody to say I have cancer. It's easier for somebody to say I'm suffering from corona. I'm suffering from this disease, rather than talking of their mental condition. And you'll only know when somebody has accepted that I have a problem. So that aspect of the, the stigma surrounding mental problem, stereotyping a normal, is a huge barrier for people to seek help, and until maybe some people identify them. If we look at the mental health continuum, the way it is, you start from our right, this is my left, where you are, the person is healthy, and that is the green zone. And at the green zone, the person is very calm, steady, they are productive, they are confident, they'll be able to fit in, they are able to rest, to decide to rest, they can feed themselves well. And by this green zone, this person is able to read by example. But as the problem continue, you see this person becomes impatient, they are they get into forgetfulness, negative attitude, muscle tensions, and all that, and they become reacting. And from there, they start now, they start reducing the barriers. Then you go to the orange area, from yellow to orange, where you see this person is now injured, and now some symptoms start manifesting themselves, like they have angry outbursts, risk taking, they are more prone to accident, until now you move to where now the red zone, where now this person is actually completely affected, where there is decreased functionality. This is the time people have suicidal thoughts. And if this person goes to the doctor, they are able now, they can diagnose and point to some disorders which are related to our mental. And if you look at that, at this particular time, whether you're in the orange and the red zone, you need to connect with the resources so that you are helped. So we start at a point, and the two allos are reversible. You can go to the extreme, and also it is reversible with the help, as we shall see later. The question we are asking ourselves: what are the risk factors that contribute to people getting into mental illness? And before I move on, it's good to, when we are talking of mental illness, these are diagnosable conditions that have affected our mental, that revolve around our mental well-being. There are two words that are used: mental illness and mental disorder. When you're looking at a mental illness, you're talking of a disease that is diagnosable and the patient is able to seek help. Mental disorder is more of a condition that is legal. It's a legal term where if you're in court, the court may order for your mental assessment to assess whether you have a mental disorder that can affect you. But those two words are interrelated. One is talking when somebody is free, you can seek medical voluntarily. But when it's a disorder, from a legal perspective, you do not control the aspect the court decide, or the legal framework are used. So the risk factors we have, one of them is genetics, where people are predisposed to some of the problem because of their genetic conditions. Others are family history or personal history, which carries so many other things. Then we have trauma, people who have been traumatized. They can also get into mental illness, personal stressors, or workplace stressors. And when we are talking of workplace stressors, we have a lot of them. We have work overload, we have low conflict, we have leadership, and all those. So you need now to look at your workplace and ask, what are the risk factors within our workplace that can cause us have a problem. The other one is, what causes mental health problem? We have talked about quite a number of them. And one of the areas, because our concentration so much is about occupational mental health problem, one of them is poor working environment. And when we are talking of poor working environment, we are discussing things like discrimination, where people are discriminated. Like now we have been having a lot of our Kenyans people going to the Middle East, Qatar, going to Saudi Arabia, going to all those other countries. And because of the discrimination maybe they face there, and inequalities, excessive workload and all that, some of them are inclined to come back. It's like when you get there, you are in a situation where you're not able to control, and you have low job control, and also you're not certain of your tomorrow. You don't have the freedom even to shift from one person to another. Those things now affect our mental capability, and they pose a risk to our mental health. That is one. So workload is one. When you have an excessive workload, it's very clear. If it is inequality, people are promoted maybe because of their ethnic background, because of their relationship with the leadership. All those can affect people and can be a contributing factor to that. Childhood abuse, trauma, and neglect. I have a friend of mine who was telling me of a research that has been done to try and trace why we are having the brightest children, the A class, getting into drug and substance abuse. And one of them is being traced from child abuse at an early stage of the trauma they were being exposed to. Then there is social isolation or loneliness. And especially, you look at the age of people who are 60 and above, you have retired, nobody is taking care of you, or you are in a workplace as a senior person, nobody is coming in to help you, maybe you are just as isolated and all that. The other one is social disadvantage and poverty or debts. They are, and especially social disadvantage, because maybe you are struggling to move from one level to another. I'm glad that now people are looking at an inclusive approach to society. But when somebody feels disadvantaged, somebody feels that denied and all that, they can get into mental problem. Even poverty, because you may lack basic need. Debts is one of the things that is affecting us, and especially like now when we are having so many gambling companies within within our society. You find that our worker is betting so much, he's addicted to betting or to substance abuse, and so they are always on the negative, and they find themselves with a lot of debts, and or they are borrowing money that they cannot be able to manage. And so because of the stress and the way they are feeling, they get into mental disorder. The other one is bereavement, losing someone close to you, or severe or long-term stress can also be a problem, or having a long-term physical health condition. You are asking yourself several questions, and that's why the workplace must be aware of what surround our area. Then we look at the protective factor. When we look at the protective factors, we are looking at issues that are able to help us protect ourselves against mental illness. One of them is social support, proper relationship. They are able to give us a sense of belonging. When we also have a good sense of belonging in the community, or there is a lot of culture connection, you are able to relate with the community, you're able to relate with your people. That's a protective factor. Then the environmental factor, we're looking at our workplace, our community, and our home. Are they supportive? Are they places where you enjoy being? Then there is also now personal resilience, because all of us have different coping mechanism. One of the issue is about our physical resilience, emotion, well-being, personal coping skill, and also being optimism. So those are some of the protective factors that you'll find we have, and they are able to help us cope with mental issues in the workplaces. So what are the warning signs that that something is not right, and especially when we are dealing with mental health? Some of the warning signs we have an increase in unexplained absence of sick leave. Somebody is having some unexplained sick leave every time they want to be out of work. We also have poor performance. Their work performance is affected. They are not able to perform. They are no longer productive as they used to be. Then we have other issues that are there, including our maybe somebody being absent in the workplaces and all that. They are not able to perform their work well, poor timekeeping, issues to do with the increased intakes of alcohol, tobacco. Somebody is ever on coffee, there is a lot of increase in caffeine taking. Others will complain frequent headaches and backache. And that's why even when we carry out occupational health and safety audits, we always ask what is the common illness among the workers here, so that we are able to see whether there are some factors that are kind of related to whatever these people are doing. Others withdraw from social contacts. When somebody is having some challenges, they don't want to be identified with some other people. Others, there's poor the judgment or indecision. And also there is constant tiredness or low energy, initial display of emotions, e.g. frequent irritability or tearfulness. They are not resistant. Emotionally, somebody will have some difficulties in controlling their emotion. Their emotional intelligence have gone down. Then working slowly is also part of that, or missing deadline. Somebody is given deadline, we're doing this up to this time, but they will never meet the deadline. They have difficulties in concentrating, withdrawing from work activity. Others will get into overworking themselves, appearing numb or emotionless, or forgetting directive, procedures, and requests, and also having difficulty with work transition or change in a routine work. So those are some of the signs that you look at, and once they are persistent, then you can know something is not right with this worker. So once you have done that, what is our responsibility as workers, as managers, as human resource officers? One of them is responding to this condition. We cannot afford to not allow this person to be part of us. We need now to respond appropriately and be able now to work with this person so that they can be able to be helped, or they can also be able to recognize what there is within themselves and work out toward having a solution. You realize that some of these people, because of the element of denial, you need to be very cautious when you are dealing with these people. Initially, we had the 3 R's that we used to use in a workplace in terms of intervention. But now in the framework of response, we have already added the fourth R, that is reconnect, because we have recognize, respond, refer, and reconnect. Because this person, after you have recognized, you have responded, you have referred this person, they also need to be reconnected. But you realize as we move on with these steps, each of them need a specific approach to whatever we want. And for example, when you are responding, we're talking of responding with a lot of respect, because this person is very, very important to us. And we have general tips of how to respond to somebody who has mental challenges. One of them become, do not engage in argument of these people, because some people will because of the condition they are in, they would want to create a scene. So it's very important for you to be calm. And when you are calm, you are becoming patient and understanding. Then check assumptions. What are the assumptions that I'm making, so that you're able to separate the behavior from the person, and also consider the goal. Where am I going? What is the reason that I'm engaging this person? At this particular time, you realize that you'll be able to use what we call positive, non-judgmental language. Don't tell this person you're doing this. It's possible for you to approach these people in a better way. But as you are doing that, be positive, be non-judgmental, so that this person do not resist you from the word go. Because if they resist you, it will also be very difficult for you to help this person. Encourage self-directed choices. One area we fail is when we present ourselves as solution makers. As a responder, as somebody in the workplace, as a manager, as a practitioner, as a community leader, do not present yourself as a solution. Let this person come to the realization of their problem, so that you engage them, so that they can have a self-directed choices. And when you're doing that, you need to consider verbal and non-verbal communication. There are things you'll do, and this person feels this person is not for me. I'm lost, and they may offer assistance. The other one is responding to behaviors. How do you respond to behaviors that are exhibited by these people? Like somebody is crying, not responding to verbal question, they are irritable comments, they have slow movement, slow talking, they are keeping their eyes closed or looking away. As somebody who is ready to help, use a warm, accepting manner. Let them feel this is me. I remember those we visited a lady who was admitted in one of the mental hospitals in this country, and we went with her sister, and we were looking at that patient. But when we were talking, she was very resistant, because the way, the language in which was being used. But when I accepted to have an accepting manner, engagement, and realistic, this lady accepted to take health care, because I was empathetic. I wanted to put myself into the shoes of that person, so that you can be able to come up with a solution, and also be patient and understanding these people, and then allow the person time to respond. Do not let it not be your way. Let it not, it is this way. Allow them to time to respond, and always encourage them and ask, how can you help? Let them give you the permission, as you're using the ATEP framework, where you're trying to engage this person to be able now to come to terms with what is there. So, and when they realize that, majority of them will be able to allow you to do that. The other one is, if the person seems to say they are very frightened, need to, or they are trembling, or they looking around very quickly, those are signs maybe you don't know because of what is happening in their mind. The first thing you do, stay calm. And then as much as possible, decrease environmental stimuli, those things that are going to affect them or to promote unconducive mental behaviors. Listen to the person and ask the questions directly. Do not do them. And then the other thing is respect their personal space. It's very important to only get into the space they have allowed you, and then offer acceptance and reassurance. Let them know you're there for them. Let them know that you accept them, and then reassure them that you're working with them toward them coming up with a solution. Then if the condition is severe and it cannot be able to handle, it is time to call or have that person call crisis lines. We have hospitals that are coming in Kenya. We only have the 99 and the emergency numbers. And I think it's something which we should be working, because the organizations that are dealing with mental conditions, majority of them are actually, we have a few government institutions these days. Now we have Chiromo, which has come out, and it's good to look for a support so that you can get a psychological, you can get a psychiatric help or psychological help for this person. And if it's an emergency, like somebody is developing heart attack and all that, you need now to call for ambulance so that the person can be taken to the nearest health facility. Up to there, I don't know whether there is any comment or question. Any question or comment? Are we together? Tuko pamoja?
Yes.
Yeah. Okay. Sawa sawa. Any any question? James, do you have any question?
No, sorry for attending late because I have some other perform. But it's a question I wanted to ask. No, sometimes workplaces find some people, maybe, for example, where I'm working, some people go maybe 1 or 2 days minus getting proper meat. Now, when people come to work and they are on site and we find maybe the environment there is very hot, you can find that somebody just cell maybe falling down is uneasy or is doing some abnormal thing. No, will that one show you that this person maybe mentally is not good, or how can we come down? Because in some places we find that some people maybe they are not all that, they don't get all this the way they're supposed to.
Is it possible for you, James, to put your mic properly?
Sorry?
Yeah. Now you can talk.
I was asking in some stations like where I'm working, you find some workers, maybe they don't get enough meals. Maybe they come from poor areas whereby getting a meal is a problem.
Yeah.
Now when they come to work, some of them have encountered such cases whereby somebody can fell down or somebody starts troubling. Finally, that person, maybe you fail to understand what exactly the problem is. And you know, most of these people, if they tell you the truth, sometimes they think that maybe you can tell them to go. Now, what are you supposed to do in such a scenario?
Okay, understanding you, because you see, like now there are two issues that you are bringing up. One of them is an element where somebody is hunger They don't get adequate resources. And you know that is actually one of the cause of mental problem, because how do you feel when you are going to work, you don't have enough food, maybe you have a family, they are not well fed. It's a point of concern, because some of the triggers of mental issue like stress is uh, part of the factors that contribute to mental problems, because the pressure is too much on you. And in the workplace, we normally, if you get some of those things, it is always good to do a risk assessment, and especially because when you are looking at risk assessment, we normally have 5 hazards. We have physical, we have economic, we have psychosocial, we have chemical, and we have biological. So you realize that mental health revolves around psychosocial hazard, and it's good for you as the EHS manager or the HR manager or the supervisor or the person in charge to be realistic with your site-specific activity and also with the community. And remember, when we're looking at the 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 support factors, as we shall see later, you realize that the community itself is very key in terms of the way we respond to an issue, because one site in Nairobi will be different with a site which maybe is in Kisumu or a place like Turkana. And if you're not careful, you might find that that has affected the performance of those people, because it's a physical condition which is now pushing this person to a mental condition, because you said we have mental condition that can push us to physical condition, and also we have mental condition that can push us to have physical condition. Am I clear on that?
Yes, yes.
Yes. Any other comment? So let's move on with the class. We shall interject later. The other concern we have is if a person is speaking loudly or speaking very quickly, arguing a lot, throwing things and making threats of violence, move that person to a quiet area, reduce the number of people and sound, speak clearly and concisely with those people, be honest and direct, set constructive limits on negative behaviors, and then follow your workplace safety guidelines. And then it's always good to allow choices. And also, as much as we have a person with a problem, it is very, very important to separate the behavior from the person and then focus on the present situation, because sometimes you find somebody thinking that this person, because they are behaving like this is the real person. It's very important for us to separate the behavior from the person. The other one is about having a conversation with a coworker who is having some mental challenges. One of the issue is prepare yourself. It is I've found that in this career where people always think they have an answer, and sometimes you're not prepared. It's good to prepare yourself. Look at the time for intervention. Look at the place where you are. What are the resources that you have, and also your mindset? Because if you have a different or a negative mindset, then you might find instead of having a solution, you are having a problem. Then the other one is it's good to validate what has been good and change you have seen in this person. And like when you're telling them, I have noticed you are a very good worker, you've been doing A, B, C, D, but of late, there's something which I've noticed that is not right. Maybe I've noticed that you're coming late. Is there anything we can help? Then there is a wondering. Be open to listen and understanding the other situation. What is it that they're going through? And then always be there. What can both of you and the other person do in order to return to working well? That is where you come to assist this person. And it's always good to take a moment for your own well-being. Don't just push yourself. And I always advise people that even when you're dealing with any case, whether it's counseling, whether it's discussion, always have a notebook somewhere. Immediately that person leave your desk, just note what you have done, what you have talked and agreed in short form, and then close that day. Do not let it sink in your heart. And then when you be having the next appointment, that is when you will open your book and say, this is what we discussed, and remind yourself where you left so that you don't carry those issues with yourself to your own detrimental. If somebody pushes you back and maybe they don't want, accept their response and indicate, I'll be there. If you change your mind, if you want me to help, I'll be there. Keep trying with offers of help with the genuine care and concern. And your offer of support must have a positive impact so that it is not just you're being their concern. And don't engage in discussing those people because of their condition so that the other colleagues will not victimize them. And then how to support staff experiencing low mood or depression. Kindly continue to treat them with respect. Believe that they can recover because it is a possibility. Don't just look them as a case that is gone. Acknowledge their value and point out their positive contribution, and then offer encouragement and support. And I want to repeat this. Continue to treat them with respect because they can recover and become productive once again. And then make accommodation as needed. If there is any adjustment that need to be, make an accommodation as needed, and then encourage staff that you are concerned about to visit their doctor or contact EFAP, what we call Employee Family Assistance Program, because reference is very, very important because you have your limitation and there are other people who are professionally trained to handle such cases. And when we are talking of accommodation in the workplaces, we are looking at adaptation that allow the person to continue to do their job. What is it that we can do so that we can accommodate this person? Are we going to give flexible scheduling of our work? Are we going to allow frequent breaks? Are we going to divide large assignment into smaller tasks so that we can reduce the causes or the factors that are predisposing these people to mental condition? If it's a stressful environment, is it possible for us to rework that whole environment? If it's a dysfunctional job, how are we going to treat it? The other concern is that you realize that these days, especially we have seen toward early this year, we had several police officers committing suicide. Why are they committing suicide? And sometimes people discuss suicidal thoughts and people don't take them seriously. So it's good to ask about suicide. If you suspect the person may be at risk, let openly discuss and talk about suicide seriously. Sometimes they think that is the solution. They think nobody appreciates them. But when it is openly discussed, it can change their perception. Remember, some of these mental challenges, psychotherapy comes very fast, very hardy. Others are closed within themselves. Some of the reason why they are in this condition can be traced very far away. So it's very important to do that. And number three, refer to resources offered through non-support group and in the community. There are some structures within the community. We have hospitals, we have institutions that support people. We have anonymous groups that are available for people to be supported. In Kenya, majority of us, We know Madare Mental Hospital or Madare National Hospital. We have another one in Gilgil. We have some private coming. We have psychiatric departments within every referral hospital, whether it's a county referral hospital or sub-county referral hospital. They have psychiatric nurses. They have psychiatric doctors who are available. It is always good to refer these people so that they can get professional help. If you look some of the people who are misusing drugs and all that in your workplaces, some of them have traumatic condition or depressive disorders which are started many years ago, and they need to be helped. So with the professional help, you can be able to work it out. When you're looking at the framework for support, we are looking at where the problem can come from the housing, from work, education, and income. And all these are surrounding the person. And then you can see the outer, we have informal support, we have formal support, we have community support, and also self-help. All these are linkages where we can be able to connect the person so that he can be helped and recover and become productive. After you have referred this person, reconnect if possible. One of the areas is medical illness, is a medical condition. So this person will also need his social support. And we are saying everyone has the right to keep this information private. If they don't want you have helped them, they don't want to be known, let them have their privacy. And the other thing that as you are reconnecting with them, don't shout their problem to the other workers. Don't give them example. If you are a pastor, don't start saying that even so and so was having some mental illness and that is how I help, because we have seen it even in our pulpits where people they are exhausted, some demons, and the pastor prayed with them and will come proudly and say this person was infected and all that. Respect the person boundaries. Let them keep the information, be empathetic and open, offer connection and support, respect the strength of each person. Then accommodation is not a special treatment. When you're accommodating them or rescheduling is not a special treatment, it's just part of creating a work environment that is conducive for this work, whether even it is a home. And that's why we are saying creating a healthy workplace is very, very important. We are looking at the physical environment. We are looking at employee health and lifestyle practices. We are looking at the workplace culture and supportive environment. And all these are going to help us create a healthy workplace. Once you have done that, you'll be able now to look at your work environment. How can the workplace help someone recover from depression or mental condition that was there? And also ask yourself, how can the workplace contribute to low mood or depression? So those things that are risk factors, you work on them. Those things, there are issues that are supportive factor, you improve them so that you create an environment that is very conducive for that place. And how do you come up with those ones? One of the key factors when you are creating a healthy workplace is leadership. There is organizational culture of trust and respect. You are creating an organizational culture where people trust one another, they respect. You reorganize your workload and the pace of work so that nobody is overworked to create stressful environment or to create factors that can predispose this person to mental disorder. Then avoid low conflict in the workplaces by creating a proper work environment. The other one is employee involvement. Involve employees in your program. Let them feel they belong. Work scheduling. Schedule the work with considering the environment and the workers. Don't just schedule for productivity. Let them be part of your scheduling. Physical work environment must be conducive, proper chairs, proper writing, proper offices, proper working spaces, employee recognition. Let the person feel this is the company that I'm working for. They value me. I'm part of that. Then there is education and training. ensure they are training, because training improve persons' knowledge and skills, and then there is also improved interpersonal relationship. Let them people belong. Like now, December, most companies are doing team building and all that. These are things that bring workers together. They feel they belong and all that. And I've also given you the stress and depression continuum. You can see up to where the person is resilience, the stress. Once you go to from stress to strain, then you start being dysfunctional. There is burnout and the breakdown, and you get into disorder, which you are referring as stress. Eustress is where there's a lot of anticipation, there's stimulation and challenges, and this is what we call the positive stress. The other one is distress. And if you are not careful, what was eustress can become distress. And it's very, very important for us to look where we are. If somebody's resilience it has been bypassed, then you avoid over engagement, you avoid overreactive emotion, urgencies, and loss of energy, because those are things that are going to come up when you are distressed. You have a lot of that, and then your performance start going down. At eustress, it was up. As distress, the performance goes down. The other one is self-care. It's good for the worker to be educated on self-care. Practice healthy nutrition, good eating, breathing, practice work-life balance or life-work balance practice, whichever is the one you want to adapt. Seek and give support to co-workers, the family, and the community. Take a break. Don't be a workaholic every time you are there. You want to be known to be working. And I had an experience where somebody was working throughout the year. If you want work to be done, the gentleman was the one who was being caught. Relax, do work, debrief difficult situation. Have somebody you can share with. If it is a situation in the work, like us when we are in the healthy center, in the healthy practice, somebody dies in the theater or somebody is a patient, you tried all that you could do. And you come out of theater thinking nothing has happened and you've already lost life. It's good to believe, discuss it, discuss openly. Ask yourself as colleagues, where did we go wrong? What is it that is affecting us? These days we have a lot of people taking Panadols in the office. Take care of your mind and body. Don't allow unnecessary competition in the workplaces. And then treat yourself. Good to have a holiday, it's good to have a walk, and even swimming. Sometimes you go outside, not because you're joining a destructive support system, but you want to also take care of yourself. And the other component, which is among the last thing that we want to talk about, is about where mental health first aid can help. We are used to the physical first aid, we are used to the normal first aid, but we have mental health first aid. And next year, we are starting training on mental health first aid. And this one can help in terms of prevention, early intervention, and treatment, so that people can be able to know how to handle cases of mental health and the help we can do that. We're looking at mental health. We are looking at people assess for the risk of suicidal harm in the workplaces, how you plan it, listen when you are non-judgmentary, give reassurance and information, then encourage appropriate professional help, and also encourage self-help and other support strategies. So all this will help you be able to address mental health issues, because some episodes are very, very dangerous. So I want to stop there and request you, there is any question, any comment. I'm ready to handle that as we wind up.
I have a question.
Uh-huh.
Hello, I'm James. I've got a question. It's regarding to what actually you have talked about pertaining to stress and depressions in workplaces. I'm giving an example because I know most of us we have worked with the Indian companies. Where I mean the companies which Indians are in the management. You know the way they usually do their things.
Yeah.
Now, you know, sometimes they do go even with the casuals, maybe they shout at them, and then maybe the casual himself has got his problem from home. eh? In situations like those ones, what what best practices are we supposed to employ there in order to make our people not to get into stress or depression? Thank you.
Okay, thank you, James, for that question. I know that is sometimes very stressing, especially when and it's revolve around the leadership because somebody feels he has authority over you. And you realize in most cases, it will not be all the Asian managers who are there, but you'll find there will be a lot of maybe one specific manager or one specific leader or one specific individual who is doing that. One area which we have always advised people is if you have a health and safety committee, which is initiated because it's within the legal framework that every workplace which has employed 20 or more people should have a health and safety committee. If you have a safety committee and you realize this is causing psychosocial problem to the workers, it is always very important for you as an individual to raise it within the committee, so that the health and safety committee can discuss that. If the committee is not there, then it becomes a HR issue that this person is causing harm and people are being all affected because of one
Yes.
of the things.
Huh?
Is
I
that
think
okay, James? Because it's just a matter of engagement and because these are individual behaviors rather than a corporate behavior.
Okay, understood.
Yes. So Mary, are you there? You have a question?
Yes, I'm okay, sir.
Yeah, I'm asking now, Mary.
Go
Iloncho,
ahead.
Arwanga, any question?
Yes, I'm okay. I'm okay, Francis. I'm okay.
You're okay?
Yes, Francis, thank you.
Okay. Collins,
Yes.
Yes, sir.
are you okay?
Yes, I'm okay. I'm following. I'm just what can I say? I'm just increasing my GB.
Hesbon, you are among the people who went at first. Any comment, any question?
For me, I'm grateful. At least I've learned a few things. I've learned how also to handle part of some stressors and how to move around, and also how to be able to deal and identify colleagues who experience such kind of issues.
Okay. Angeline?
Thank you very much, Francis, for a good presentation. I'm happy.
Yes.
I'm very concerned because it's part of my 2023 goal.
Yeah.
I've learned a lot because even currently there are some employees I'm trying to deal with, but they are a bit difficult. You see someone, you take him through the process, they change, then after 1 or 2 years again, they repeat the same mistake. So
Okay.
I'm just praying that everything will go well since I now have the tips. Thank you.
Yeah. Yeah, and it's very important, Angeline, even as you're looking at them, to identify what we call the risk factors within your workplaces. I was in a training and as we were discussing this,
Yes.
we found some people saying that a certain cadre of professionals within that workplace are used of taking alcohol during lunch hour. And they have identified a place which is a bit far away from the workplace. So you see, by the time they're coming out from lunch, all of them, they have taken a certain amount of alcohol. And that shows when we were discussing, we said, can we identify the reason for that? Yeah. So without any other comment, I want to refer back the meeting to Naomi so that she can wind up, unless there is any other question we can address within the few minutes remaining.
What if someone doesn't want to share, like you get in an office, they're, what do I call them? They're addicted to alcohol. And when you try to speak to them, they are not willing to speak out, either to the HR or maybe to the head of department. And when you speak even to the family members, they also say that they've tried talking to that person and maybe he's not willing or she's not willing to share what is maybe bothering them. So how do we go about it?
Okay, and that's okay. That is a very good concern, and it's Elizabeth. That is something which has been affecting so many working places, because you have somebody, and in most cases you realize that those people who are addicted in alcohol and drug in the workplaces are the most brilliant and most productive people, the most technically, very technically qualified. And sometimes people feel they might not be able to, they are not able to release them. But it's good to, we have what we have called the Employee Family Assistance Program. Some of them are external, and sometimes as a HR or as a leader within the department, if it is affecting his productivity, remember the company cannot afford to pay this person when he is very unproductive. And that's why they are engaged, and you call them and straight you tell them, we have realized this and this is affecting you, because now it is going beyond where they are controlled, and discuss openly with them. I have ever done that, and tell the person straightforward that this and this is happening, it's affecting you. So we need now to relook at it. And we want to walk the journey with you. We want you to look for assistance. We want you to be able to engage so that you can overcome this problem. Otherwise, if it is not possible, there is a time when the company cannot sustain them. So they need to know that they have a problem, and sometimes there is what we call direct confrontation of the problem. It's like somebody telling you, I'm going to kill myself, or you see somebody having suicidal thoughts, and you have met something which is leading to that. Are you going to keep quiet? Sometimes you confront the giant in the house and say, some of them are very senior, they're directors, and they will dismiss you. But are they going to help themselves if they dismiss you? Sometimes if it is beyond their control, and you realize majority of them are always in denial, they are pretending there is no problem, but there is a problem. Sometimes you need to confront the problem, engage the person a bit soberly, either through a person they can relate well, or the HR now take an initiative to discuss the problem.
Thank you.
Yeah. So Naomi, you can take over.
Okay, thank you, Francis, and thank you everyone for attending the session. It has been a brief session, but very informative. So we appreciate you, and you are always welcome to engage us further for the more detailed training. We can also come and train your staff on this the mental awareness. Thank you, and have a lovely afternoon. And you can share your emails for the notes. Thank you.
Thank you so much. Enjoy your Christmas.
Okay. Thank you very much. Have a good day.
Merry Christmas.
Thank you.
Happy New Year.
Happy holidays. Merry
Enjoy your
Christmas.
holidays.
Happy New Year.
Happy holidays, everyone.
Happy holidays, everyone. God bless you.
Thank you.
Asante sana daktari.
Karibu. You guys are free to leave.